Onc Live Insights is a video editorial program produced by Onc Live.
Pazopanib is a multi-targeted tyrosine kinase inhibitor that targets the vascular endothelial growth factor receptor, among other targets. It's unclear to what extent it's superior to sunitinib, although there is some indication that it's, on average, a better tolerated drug, and at least in the renal cell field, it seems to be a drug that's used more commonly in the first-line setting. In phase 2 studies, it was associated with response rate of approximately 20 to 30% in pancreatic neuroendocrine tumors. It's being studied now in a randomized fashion in non-pancreatic neuroendocrine tumors, carcinoid tumors. Hopefully we'll see studies in pancreatic neuroendocrine tumors that will establish whether pazopanib should be the anti-angiogenic drug of choice in this disease.
Another VEGF inhibitor that has been studying pancreatic neuroendocrine tumor is pazopanib. This is actually a project that I shared with Dr. Koki, who is also on the panel. In a study between MD Anderson and Dana-Farber, we accrued patients with both neuroendocrine tumor of pancreas and also outside of pancreas to a phase 2 study in 2 separate cohorts. We saw a lot more activity in the pancreatic cohort. The response rate was about 22%, and median progression-free survival of 14.4 months was observed as well. So while this is not a randomized study, the historical progression-free survival from the control arm of both the everolimus study and the sunitinib study are pretty consistent in the 4 to 5 months range. So the 14.4 months observed with pazopanib likely indicate the drug is also active. I think what we're still missing in this area right now is a randomized study to definitively answer the question. Sorafenib has also been studied in neuroendocrine tumor. This was led by the Mayo group who did the phase 2 study and was reporting at ASCO a few years back. Similar to what we saw with pazopanib, there was more activity potentially observed in the pancreatic neuroendocrine tumor group comparing to the non-pancreatic neuroendocrine tumor group. But sorafenib was a little bit more difficult to tolerate in the neuroendocrine patients. If I recall correctly, about 60% of the patients had to discontinue therapy due to either adverse events or withdrawal consents. With improved understanding of the molecular pathology of these tumors, another type of therapy that are being investigated is actually CDK4/6 inhibitors. At MD Anderson, we're just launching a study looking at LEE in patients with foregut neuroendocrine tumors. So those patients with neuroendocrine tumor of the pancreas as well as of the lung or thymus.